Many adults have erratic sleep schedules and durations, and so clinician discussions emphasizing the importance of some core sleep hygiene principles can be a helpful first step in optimizing sleep health. The regulation of the rise time, the time that one arises every day to start the day, is strongly associated with the proper regulation and timing of circadian rhythms. Conversely, variability in the rise time can create circadian misalignment. Over time, when this step is implemented, patients will experience sleepiness around the same time every day, which will invariably lead to a regular bedtime and an overall more regimented sleep pattern. Number 2, setting aside sufficient time for sleep, but not spending excessive time in bed. In addition to proper timing of sleep, it is important to remind patients to optimize the duration of sleep. Most adults need about 7 to 8 hours of sleep, and time spent in bed should be enough to get 7 to 8 hours sleep without having significant time awake, for example, more than 30 or 45 minutes. Doing other waking activities in bed, such as using electronics or watching television, counts as time awake, so it is generally helpful to recommend avoiding these activities in bed. 3. Using electronic devices, such as smartphones and tablets, close to bedtime can delay circadian rhythms, and other stimulating activities such as talking on the phone, texting, or playing video games can also be cognitively stimulating, all of which make it more difficult to relax and fall asleep. Prior studies have found particularly longer sleep latency, worse sleep efficiency, more sleep disturbance, and more daytime dysfunction in adults who use a mobile phone after lights out. Good general advice for patients with insomnia is to avoid all stimulating drugs and substances. Example, stimulating alerting antidepressants, bronchodilators, thyroid hormones, corticosteroids, decongestants, caffeine after lunchtime, nicotine, and evening alcohol, or, when certain activating alerting prescription drugs are necessary, to time administration earlier in the daytime with avoidance of nighttime dosing whenever possible.